Ladies and gentlemen, go forth to do great things for your mind, your body, and your American spirit. This is a comprehensive health insurance program brought to you by the Nixon administration, who partnered with Kaiser Permanente to change hospital and healthcare in America focused from patient focused to profit focused, which is similar to the ACA today. So, this is a text on the speech that Nixon gave about his brand new CHIP, Comprehensive Health Insurance Program. First, it offers every American opportunity to obtain balanced, comprehensive of health insurance benefits. Second, it will cost no Americans more than he can afford to pay. Third, it builds the strength and diversity of our existing public and private systems of health financing and harmonizes them into an overall system. Fourth, it uses public funds only where needed. Fifth, it would maintain freedom by choice by patients and ensure doctors work for their patient, not for the federal government. Sixth, it encourages more effective use of our health care resources. Seventh, it organizes that all parties would have a direct stake in making the system work: consumer, provider, insurer, state governments, and the federal government. Three plans offered broad and balanced protection for all Americans. 1. Employee health insurance, covering most Americans and offered at their place of employment. 2. Improved Medicare plan, covering those 65 and over and offered through a medical system that is modified to include additional needed benefits. 3. Assisted health insurance, covering low-income persons and persons who would be ineligible for other two programs, with federal and state government paying those costs beyond means of the individual who is insured. One of these plans would be available to every American, but for everyone participate in the program would be voluntary. The benefits offered by these three plans would be identical for all Americans, regardless of age or income. Benefits would be provided for hospital care, physician care in and out of hospital, prescription and life-saving drugs, laboratory tests and x-rays, medical devices, ambulance services. There would be no exclusions of coverage based on natural nature of the illness. In addition, it would cover treatment for mental illness, alcoholism, and drug addiction. Certain nursing home services and convalescent services would also be covered. Home health services would be covered. The health needs of children would come in for special attention, preventative care up to age 6, eye examinations, hearing examinations, regular dental care up to age 13. A doctor's decisions could be based off the health needs of his patients, not on insurance coverage. Every American participation in the program would be insured for catastrophic illness. No family would have an annual out-of-pocket cost for covered health care services in excess of cap. Low-income families would face substantially smaller expenses. A health card, similar to a credit card, would be honored by hospitals, nursing homes, emergency rooms, doctors, and clinics across the country. This card could also be used to identify information on blood type and sensitivity to particular drugs and info which might be important in an emergency. Bills for the service would be paid for with the health card would be sent to the insurance carrier, would reimburse the program and the provider for health care services, then the bill be for his first share, if any. How employee health insurance would work. Every employer would be required to offer at full-time employees comprehensive health insurance plan. Additional benefits may be included by mutual agreement. The insurance plan would be jointly financed, with the employer facing 65% of the premium for the first 3 years of the plan and 75% thereafter. Employees would pay the balance of the premiums. Temporary federal subsidies would be used to ease the initial burden for that on employers facing a significant cost increases. Individuals covered by the plan would be a paid deductible. A separate deductible provision would be applied out of range for drugs. There would be a maximum of 3 medical deductions per family. After satisfying the deductible limit, an enrollee would then pay 25% additional bills. There would be an additional annual max out-of-pocket cost on families' medical expenses covered services. As an interim measure, the Medicaid program would be continued to meet certain needs, primarily long-term institutional care. Improving Medicare. Medicare's benefits would improve so that Medicare would provide the same benefits others to Americans to employee health insurance and assisted health insurance. Persons 65 or over eligible for Medicare and payments would pay a lower deductible and lower separate deductible for out-of-patient drugs. He or she would also pay 20% of any bills above the deductible limit. There would be an annual max out-of-pocket cost for any Medicare beneficiary have to pay. The premium and cost sharing for those with low income would have be reduced, with public funds making the difference. Those in Medicare for the disabled plan would be eligible for assisted health insurance, which would provide better coverage with those who had high medical costs and low incomes. But how would assisted health insurance work? Assisted health insurance is designated to cover everyone not covered under the employee health insurance for Medicare, including the unemployed, the disabled, the self-employed, those with low income, and persons with higher incomes. They cannot get coverage at reasonable rates, barring a person who is health status type of work plus in a high-risk insurance categories. A principal feature in assisted health insurance is that related premiums and out-of-pocket expenses to the income of the person for family enrolled. Working families with very low incomes would pay no premiums at all. Deductibles, co-insurances, maximum liability would be pegged at low income levels. Assisted health insurance would replace state-run Medicaid for most services. Preempt state mandates. This plan would establish uniform benefit and eligibility standards for all low-income persons. It would also eliminate the artificial barriers to enrollment or access to health care. Making the healthcare system work better in the Nixon administration. To contain medical costs effectively over the long haul, however, basic reforms and financing and delivery of health care are also needed. Professional Standard Review Organizations, PSROs, would place the health services under the review of the Professional Standards Review Board organization. The PSROs would be charged with maintaining high standards of care and reducing needless hospitalizations. Operated by groups of private physicians, professional review organizations can do much to ensure quality care while helping to bring about significant savings with cost. The states would approve specific plans, oversee rates, ensure adequate disclosures, require an annual fiscal, assure fair reimbursement for physician services, drugs, and institutional services, including a prospective reimbursement system for hospitals. Only with effective cost control measures can states ensure that citizens receive the increased health care that they need and rates that they can afford. Failures on the part of the states to enact these necessary authorities would prevent them from receiving any federal support of our state-administered health assistance program. Republican President Richard Nixon, the White House, February 6, 1974. What do you think about that, kids?